Mouth care. Introduction. Mouth care is the term for brushing a patient's teeth. Most people are familiar with this procedure and should have a general idea of how it is performed. However, the skill needs to be adapted to a bedbound patient. Safety needs need to be addressed first. Since the patient is in bed for this skill, the head of the bed needs to be positioned in the full upright position at the beginning of this skill to prevent the patient from choking. It is best to adjust the head of the bed during the opening before you wash your hands, because the controls are not considered clean. Patients in bed will scratch what itches and then touch the bed controls. Therefore, hands should be washed after touching bed controls. When you elevate the head of the bed, the pillow will force the patient's head forward, making them uncomfortable. It is best to slide the pillow behind their back or remove it from the bed completely to increase comfort. This should be done before washing your hands. Placing a towel over the patient's chest will prevent their clothing from becoming soiled with toothpaste during this skill. Gloves must be worn when performing this skill. You will be exposed to the patient's body fluids and need to take precautions to keep yourself safe. You also need to keep the patient safe from any pathogens that might be on your hands. Once you understand safety, head of the bed up, patient's rights, towel over the chest, and infection control, proper glove use and basin cleaning, mouth care is easy. You will need a clean place to put your clean supplies at the beginning of this skill. This can be created by placing a barrier on top of the overbed table. The toothbrush must be wet before putting toothpaste on the bristles. Apply a very small amount of toothpaste for this skill. Mouth care does not have to be performed for a certain amount of time. Brush all surfaces of the teeth, front, back, top, and bottom, and the tip of the tongue. Then throw the toothbrush away for the test. Hold the cup for the patient and allow them to rinse and spit into the basin. This will be somewhat difficult at first and takes practice. Use the towel to wipe the patient's mouth and put the towel into the dirty linen container. Then you'll have to clean the basin. All basins in healthcare are cleaned the same way. This video will demonstrate the steps for basin cleaning, so pay attention to how the instructor cleans the basin after performing mouth care. Watch the instructional video and then try this skill on your own.